I am happy to welcome you all to our latest installment of our webinar, updating you on novel coronavirus or COVID-19. And just to ground us, this is a serious, ongoing public health emergency. It's estimated today there's nearly 400,000 cases of COVID-19 around the world, with about 47,000 in the U.S. Around the world, there have been 17,000 deaths attributed to COVID-19. So let's make sure we're all understanding this novel coronavirus and what we can do about it. So today you'll be hearing from our panel of experts we've pulled together to help address questions about the current outbreak. And our goals are to share expertise about novel coronavirus and public health concerns, to provide guidance for how to keep your employees and customers safe, and to provide industry-specific insights and practical tips to help combat coronavirus in healthcare, long-term care, hospitality, restaurants, and the food industry. It's my pleasure to introduce our experts. I will be followed by Linda Homan, who is a board-certified infection prevention specialist with over 20 years of experience. She's responsible for development of clinical and educational solutions, applied clinical research, and incorporation of clinical best practices in all healthcare offerings. Ed Snodgrass is a chemical engineer with more than 15 years of experience in new product development in Ecolab's institutional customer segment. I'm happy to join you as well. My role is to provide technical expertise and consultation to our customers on food safety, but also public health issues to identify and track these trends and new control strategies. Now, coronavirus has been around now for 3 months. It still is new, though. These are hopefully facts you're all aware of, but I think it's important to keep us grounded because it does impact what and how we would manage COVID-19. It's a respiratory disease that certainly is occurring around the world. Then we've not seen it before other than in the last few months. We're seeing that it causes fever and respiratory symptoms, and to date, we know that many, many people around the world have been impacted, and there will be more cases identified. It's important to keep in mind that this situation is evolving. Public health authorities are continuing to actively investigate this outbreak, so I urge you to please follow your local public health authorities and places like the World Health Organization or the Centers for Disease Control here in the U.S. and their guidance for the most up-to-date information. But what do we know about coronaviruses? Well, frankly, they're a large family of viruses that can cause a wide range of illness, from, frankly, the common cold to much more severe diseases as well, such as those you may have heard of in the past called Middle East Respiratory Syndrome, or MERS, and severe acute respiratory syndrome, which caused a lot of illness in the early 2000s, and that's been called SARS. A novel coronavirus is a new strain that we've not seen before, and that's what COVID-19 is. We know that they are often transmitted between animals and people, and there are coronaviruses circulating in animals that have not yet infected humans. And in fact, it's believed that the current COVID-19 originated in some animal host, although that has not been definitively identified yet, and then somehow jumped to a human, and the outbreak started. The common signs of infection that we've all heard from public health authorities are primarily respiratory symptoms accompanied by a fever, cough, shortness of breath, trouble breathing, etc. And it certainly can progress to more severe cases where infections can lead to pneumonia, various respiratory syndromes, and can be fatal in some cases. Now, coronavirus spread really depends on the particular one we're talking about. And in this case, COVID-19 is being spread by respiratory droplets from an infected person to others through the air, through droplets from a cough or sneeze, through close personal contact, such as touching, shaking hands, just being in the vicinity of someone. And this is the basis for the recommendation to maintain a distance of about 6 feet or 2 meters in between people. We also know that it can be transmitted through touching an object or surface with the virus on it, then touching your mouth, nose, or eyes before you wash your hands. We have gotten some data that has been developed very recently about survival of the actual COVID-19 virus on a variety of surfaces. And it's shown that on hard surfaces like stainless steel or plastic, it may survive for up to 2 to 3 days, but less so on surfaces like cardboard. But it's important to keep in mind that public health authorities really don't believe that transmission via these surfaces is a significant way of spread of COVID-19. Yes, it is theoretically possible, but transmission from person to person is occurring much more directly through transfer of these droplets. But this is an evolving situation, and surveillance continues. Okay, these outline some basic steps that you can use to protect yourselves and your employees and your guests and residents. My colleagues will go through these in a lot more detail, but it's important to keep in mind that control of COVID-19 really focuses on fairly standard infection control practices, making sure people are trained in how to do these and are following these. Things like washing our hands, disinfection of commonly touched surfaces. Remember, washing your hands. And in the absence of soap and water, there are alternatives like the use of hand sanitizers. The good news is that coronavirus, and particularly the one that is causing COVID-19, is a small and enveloped virus, and that relates to its structure. Enveloped viruses are the least resistant to disinfection, which means that disinfectants can be used to effectively kill coronavirus on surfaces. That is very, very good news in control of this outbreak. So protecting ourselves is really about adopting many of these standard practices. It's important to recognize that there are no vaccines available to protect you against human coronavirus infection, so it's important that we follow these practices to reduce spread. So reducing the risk certainly relies on things like washing our hands often and correctly. And we know bodies like the World Health Organization continue to promote this, recommending that we perform hand hygiene with soap and water as a primary step, or using alcohol-based hand sanitizers if soap and water are not available. To avoid touching our eyes, nose, and mouth, because that's where the virus can enter our bodies. To avoid close contact with people who are sick. To avoid areas where live animals may be being sold or raised, because, again, there can be transmission through that route. Wearing a mask, but only if directed by healthcare or local requirements. We've all heard the news about the severe shortages of masks for healthcare workers, which must get priority. And then seeking medical advice immediately if you have a fever or other symptoms, especially after traveling, but make sure to tell the doctor if and where you have traveled to. And protecting others is also very similar, especially if you have cold-like symptoms. You can help protect others by following these same practices. Again, wearing a mask, but only if advised by healthcare experts, staying away from others and home if you're sick, avoiding close contact, washing your hands, covering your mouth and nose, contact a doctor immediately if you are experiencing symptoms, and practicing proper cleaning and disinfection practices. We also need to be cognizant and be taking care of our employees. And it's many of the same strategies that we've outlined, reinforcing the need for personal hygiene and cough etiquette, closely monitoring their health, and making sure that symptomatic employees stay home per your company policies, identifying those staff who are critical, and developing a business continuity plan, considering the ability for some employees to work from home to maintain that social distance, making sure the right hygiene materials are available, and that employees disinfect their personal hard surfaces, following product label guidance, and then making sure employees are well informed of what's needed and what they need to do. So really it comes down to making sure your team knows for sure to stay home if they're ill, to contact you if they were exposed to someone who is confirmed to have COVID-19, or if they reside in a so-called restricted area, and the definition of that will vary a lot by locale, but it's important that everybody keeps everyone informed. And then making sure exposure is limited by certainly avoiding large gatherings. And we're increasingly hearing about this from local governments who are limiting gatherings of certain numbers of people, especially those who are coughing or sneezing. And then if you are keeping your business operational, making sure that there are regular cleaning and disinfection practices in place. I'm going to turn this now to my colleague, Ed Snodgrass, who will go through some much more specific procedures that will help you. Ed, take it away.
Thank you very much, Ruth. So hello, everyone. This is Ed Snodgrass. I'm the program leader as part of Ecolab's Research Development and Engineering team. And over the next few minutes, I'm going to give you practical guidance for multiple areas of your operation to help keep you, your employees, and your customers safe from COVID-19. These procedures are applicable across multiple areas of operation, including food service, lodging, long-term care, facilities, and education. We have created a three-tier guidance system informed by public health reports to help you manage risk in your operations. The first level is green, or standard prevention. In this level, follow current procedures, regularly revisit training to ensure compliance, and continue to maintain standard hygiene, sanitation, and disinfection practices. The second level is yellow, or risk reduction, or the potential exists for an outbreak in your geographic area. In this instance, educate employees on infection control, personal protective equipment use, and communicate infection control procedures. Assess your preparedness status and collaborate with vendor partners on response readiness. Evaluate facility usage, lead times, and stock shelf life and their impact on ordering supplies. And probably most importantly, increase frequency of standard procedures. The last and highest level is red, or remediation. There has been a publicly declared outbreak in your facility or region and is disrupting normal business. In this case, enhance procedures to respond to an outbreak in your facility designed to break the chain of infection or illness. Facilitate training for heightened procedures, perform heightened procedures using approved products, and plan for deep cleaning and reopening procedures after downtime or quarantine. I will be using these levels in the upcoming content to help guide you through how to manage procedures in your operations. With the current state in the U.S., it is likely that everyone is somewhere in the yellow to red risk category. I would like to ground you on some basic procedures that are important for all areas of your operation. As Ruth mentioned, hand washing is one of the best ways to help prevent the spread of COVID-19. There are 5 steps to proper hand hygiene. Wet your hands with running water and apply soap. Lather the back of hands between fingers and under nails, and do this for at least 20 seconds. Rinse hands under clean running water, and then dry hands using a clean towel or air dryer. An alcohol-based hand sanitizer can be used when hand washing is unavailable, but remember, washing your hands is considered the most effective method. I will mention disinfection in the upcoming procedures quite a bit. Here are 4 basic steps for non-food contact disinfection. First, and just a reminder, this is for non-food contact. I will cover food contact after this. There are differences. So first, for non-food contact, pre-clean visibly soiled areas to be disinfected. Second, apply the disinfectant to the surface. Third, allow the surface to remain wet for the time indicated in the directions on the product label. And fourth, wipe the surface or allow it to air dry. Always follow the EPA label directions to ensure proper product concentration, application method, and contact time required to properly disinfect a surface. With COVID-19, we recommend an EPA-approved emerging viral pathogen or coronavirus claim disinfectant. I will discuss in a minute how to select this type of disinfectant. For food contact disinfection, the steps are similar for non-food contact disinfection, however, with some distinct differences. In the first step, pre-clean the surface to be disinfected. Next, disinfect like I just discussed in the previous slide with an application of the disinfectant, waiting for the appropriate contact time and letting the surface dry. However, in step 5, you must rinse the surface with potable water, then apply a food contact sanitizer and allow the surface to air dry. Again, if there are any questions about how to use a disinfectant or sanitizer, please refer to the EPA product labels. Before we get into specific area procedures, I will show you how to ensure that your disinfectant has emerging pathogen claims or coronavirus claims and is appropriate to use against COVID-19. Look at the product label for your disinfectant and find the EPA reg number. Typically, this is a number with either 3 or 2 parts separated by a dash or dashes like you see in the red box. Record the first 2 parts of the number, in this instance, 6836-349. Use your web browser to go to the EPA-registered antimicrobial product for use against novel coronavirus. Search for the number that you recorded. If both numbers appear in this list as they appear in the label, then your product either has emerging pathogen language or coronavirus claims and can effectively be used against COVID-19. Do not search by product name. It may be different in the list than it is on your label. Go by the number. Now I'm going to give you guidance on multiple areas of your facilities and will give you advice for how to manage your operations during the multiple levels of risk. These procedures are applicable across the areas of food service, lodging, long-term care, education, and facilities. The procedures that I'm going to share with you are available to you through your Ecolab representative. Please contact them and they can get you this information. The first area that I'm going to share with you are public areas. These can include lobbies, entrances, hallways, or any area where multiple people may meet and gather. It's important to note that in public spaces, people can come into close contact with one another and will touch common surfaces. To reduce risk in these public spaces, increase the frequency of cleaning and disinfection of high touchpoint areas. This includes door handles, push plates, drinking fountains, elevator buttons, gym equipment, and other commonly touched areas. If there's an outbreak in the facility or the surrounding area, take further steps to reduce your risk by considering to close those public gathering places to limit transmission. And when possible, provide alcohol-based hand sanitizers in public areas, especially near the high touch points. An additional consideration is to limit non-essential visitors or those who have been exposed. And as always, follow all guidance as directed by public health authorities. Public restrooms are also public spaces with people coming into close contact with each other and with common touch points. To help reduce risk over standard procedures, increase the disinfection of high touch point surfaces including door handles, bathroom stall latches, light switches, toilets and urinal handles, and other areas. If you have an active outbreak in the facility or in the surrounding area, increase the frequency of deep cleaning and high touch point disinfection. We also recommend using an EPA-registered disinfectant with emerging viral pathogen claims or coronavirus claims as your disinfectant. It is very important to ensure hand soap is properly stocked and, if desired, provide alcohol-based hand sanitizers outside the public restroom. Before I talk about food service guidelines, I want to talk about food safety. Standard food safety practices are encouraged, beginning with avoiding direct, unprotected contact with live animals, surfaces in contact with live animals. Avoid consuming raw or undercooked animals or sick animals. Avoid cross-contamination by properly handling raw meat, milk, or other animal materials. Properly clean and sanitize food surfaces, including hands and utensils. So this is nothing new. These are our standard food safety practices today. And currently, there is no evidence that COVID-19 is transmitted to humans through food. In summary, continue to follow standard food safety practices, and as a reminder, continue to enforce proper employee guidelines, as Ruth spoke about earlier. So like I said, continue to follow all standard food service guidelines. To reduce risk above standard procedures, wash, rinse, and sanitize food contact surfaces more frequently. In the event of an outbreak in a facility or in the surrounding area, continue to follow your standard procedures to wash, rinse, and sanitize ware in either a dish machine or a 3-compartment sink. Continue to wash, rinse, and sanitize surfaces more frequently, and if you have a buffet line, change out the utensils on a more frequent basis. Consider the addition of an EPA-registered product with an emerging viral pathogen or coronavirus claim as part of the wash, rinse, and sanitize process following the food contact surface disinfection procedure discussed earlier. This is only a consideration. We recommend a standard wash, rinse, and sanitize process. However, for high-risk populations, the addition of a disinfection step is acceptable. And lastly, follow all guidance as directed by public health authorities, especially in regards to food handling via takeout or delivery. For non-food contact surfaces in the kitchen, follow standard procedures for proper cleaning and disinfection. To help reduce risk, increase the frequency of cleaning and disinfection of high touchpoint areas, including door handles, push plates, cash registers, etc. In locations with an active outbreak or a regional outbreak, continue to increase the frequency of hard surface disinfection using an appropriate EPA-registered product with an emerging viral pathogen or coronavirus claim. For laundry, continue to follow standard laundry guidelines. To reduce the risk to staff, use a disinfectant with emerging viral pathogen claims or the coronavirus claim to disinfect specific high touch point surfaces, including the laundry cart, housekeeping carts, folding tables and shelves, washer and dryer controls, and light switches. In case of an outbreak in the facility or in the immediate surrounding area, collect laundry with minimum agitation. Do not shake or hug dirty laundry to avoid direct contact of the skin and clothes with the contaminated laundry. Consider using gloves, gowns, and dissolvable bags for laundry collection. Some things to consider: keep the laundry movement going in one direction, dirty linen in and clean linen out. Do not use the same gloves when handling clean and dirty laundry. And per the CDC, dirty laundry that has been in contact with an ill person can be washed with other people's items. Consider disinfecting the rim of the machine and doors so that laundry is not recontaminated upon removal. Don't leave damp laundry in the machine overnight, and follow proper hand hygiene procedures before and after glove use. For pool and spa, CDC guidance suggests there is no evidence that COVID-19 can be spread to humans using pools and hot tubs. Proper operation, maintenance, and disinfection, for example with chlorine and bromine, of pools and hot tubs should remove or inactivate the virus that causes COVID-19. So continue to follow standard procedures to manage your pool and spa. To reduce risk, disinfect common high touch points in the pool and spa area, including door handles, push plates, thresholds, hand railings, tables, chairs, etc. In the event of a pool closure, either to minimize risk by shutting down a public space or a complete shutdown of the property, do not drain the pool. In most cases, it is more cost-effective to keep the pool running at lower set points and temperatures. Lock access doors to the pool area, post signs informing guests of the restriction, and perform maintenance in off-peak hours to avoid confusion. Read the bullet. Now I'd like to turn it over to Linda Holman.
Hi, everybody. Thanks, Ed. We're going to talk a little bit about guest and resident room guidelines. And so under standard precautions, you're just going to follow the process that you're usually doing. And then I would just point out that you should do hand hygiene before and after this procedure. And then for the risk reduction or the yellow, you want to increase your defensive measures and do some focused training and make sure people are really comfortable with what the high-touch objects are, what the contact time is of your disinfectant, and increase the frequency of your cleaning and disinfection of high-touch areas. And some of those specific high-touch points that you want to look at are the door handles, hard surface furniture, tables, nightstands, furniture knobs and handles, light switches. There's a full list on the bottom right of the slide. Basically just thinking about anything that gets touched by the person in the room or the person working in the room. And then under remediation or the red, you want to enhance the procedures to respond to an outbreak in your facility. And so you're going to follow those standard procedures above, and then you're going to increase the frequency of your hard surface disinfection. You're going to use an EPA-registered disinfectant that has the emerging viral pathogens claim that we've talked about throughout this presentation. Disinfecting all high-touch surfaces, not just the high-touch points. And carefully be sure to read and follow the label instructions in terms of the way to apply it and the contact time. It's important if you suspect a patient or a person with COVID-19 of having been in that space that you close off all areas that were used by the ill person and wait as long as possible before cleaning and disinfection. It's just going to allow the air exchange to turn over in the room and reduce the potential for exposure to respiratory droplets. It's also not a bad idea to open outside doors and windows if you can to just increase the air circulation in that area. And if possible, wait up to 24 hours before beginning cleaning and disinfection, knowing that that isn't always possible. Some considerations for you in this situation is to be sure to provide personal protective equipment like gowns and gloves as you're directed by the local and federal authorities. So look to the CDC for really good guidance on that. Making sure that you have hand sanitizer in public areas, and that room cleaning should be performed really frequently to minimize the spread of infection and to minimize employee risk. You want to isolate asymptomatic guests and or residents and follow the public health recommendations for infection control. Generally speaking, you would want to isolate the person in a room by themselves with the door shut. If you're in a healthcare facility such as a long-term care facility, or if you're in a situation where you have masks available, you might want to have that person that's symptomatic wear a mask in that closed room. If they're in a hospitality setting and you suspect them of having COVID-19, you might want to just ask them to go home and contact their public health authorities. And then the last thing I'll say on this slide is that it's really important to know that the CDC has great resources available that give lots of detail on how to manage these different situations. It's impossible to cover every scenario in a webinar, so it's really important that you go to your resources like the World Health Organization or the CDC, or contact your public health authorities if you have specific questions. So this is really an action plan for healthcare. So it should say it should maybe say residents instead of patients if you're from a long-term care setting. If you suspect or know that a patient or a resident has COVID-19, you'd want to have them in a private room and you'd want to have them wearing a mask. And then any healthcare personnel that are going to interact with that patient or resident should follow standard precautions as well as contact precautions and airborne precautions, and also institute eye protection in the form of goggles or a face shield. And as we've said over and over again throughout this presentation, performing frequent hand hygiene with soap and water or alcohol-based hand sanitizer if soap and water isn't available, and disinfecting surfaces with the EPA-registered products that are effective against emerging viral pathogens. So really the most important message that we have to give you here is that we at Ecolab are here to help. Please reach out to your Ecolab representative if you want a copy of the procedures that we've just gone through, because we did cover a lot and there's even more detail on the slides that we weren't able to go over in the time that we have. Please connect with your Ecolab team because we really focus on world-class training programs and tools. We have webinars, we have on-site technical support, and we have a 24/7 call center to support our customers because you're very important to us. And so with that, we've seen a lot of questions coming in throughout this, or if you have questions now, go ahead and submit that under the Q&A function. And my colleague, Ms. Nicole Arneson, will ask these questions for the panel. Thank you.
Great. Thank you so much, team. Yes, we've had a flurry of activity in the Q&A section, so we will do our best to answer as many of them as we can in the time we have now. Ruth, this one is probably more directed to you, just in regards to coronavirus having been around for a long time. But this particular strand hasn't been seen before. So just explaining a little bit more about the differences. And does the 19 after COVID correlate with when this strand was discovered?
Yeah, it does. And because the reality is is actually late in December of 2019. I know that sounds like eons ago to me, but so technically it was first found in 2019, and that's what the 19 means. And yes, it is a new strain. It's not the same as previous coronaviruses like SARS or MERS that I mentioned, or those that might be causing common cold symptoms that we see, frankly, fairly routinely. So it is a new one that emerges. And it's not uncommon, frankly, for new strains to emerge. If we think somewhat about the influenza virus, part of the reason we need to get a new flu shot every year is because we have a new strain. Think of coronavirus like that, but in this case, obviously, it's a lot more serious than flu, mainly because we don't have a vaccine available to us yet. And supportive care is what we can do. And we are seeing, obviously, some very serious illness as a result. So that's the gist of it.
Sure. A lot of other questions are related to the possibility of potentially being reinfected. So if a person who has had COVID-19 and has since recovered, can they get sick again? And if they can they come in contact with the same exact virus?
You know, there's not a lot of evidence of that happening. However, this is obviously a new strain, one we've not seen before, so there's still a lot of study of illness cases and so on. But that is not being deemed as a way that COVID-19 is being transmitted from essentially being reinfected. So that's what we know today.
Great. Another common question coming in through the system is, yes, we do hope to have a copy of the recorded webinar distributed within approximately 24 hours, just so that everybody is aware of that. These questions regarding process or procedure may be more towards Ed and Linda, but specific to the red, yellow, green. Is there any indicators around how many are needed to test positive in your either city, county, or state to be considered in the red category, or are there any other metrics to kind of help people self-select the category they belong in?
In terms of actual cases, I don't have an answer for that. I don't know if you do, Ruth, specifically.
No, and I think it really is a judgment call based on, your own particular situation in your, cities and states and so on. I think the reality is that the majority of the U.S. is likely fairly close to red, if not red, these days. So we just need to think about that. But in places, that may be very, very isolated, where there have not been a large number of cases, it's possible that you may be more in the yellow area. I think it's safe to say likely no one's in the green zone today. But hopefully we will get back to that at some point.
Great. There are a couple of questions regarding sanitizers that I want to talk about as well coming into the Q&A. Specifically around alcohol-based sanitizers are recommended when hand washing is not an option. But can you talk a little bit more about non-alcohol-based sanitizers?
So the one thing I'd say to that is that we're following CDC guidance when it comes to hand sanitizers, and they recommend an alcohol-based hand sanitizer at this point. There are no actual viral kill claims on any hand sanitizers, which is why we need to follow the CDC guidance for alcohol only. So I know there are other hand sanitizers out there, but right now they're currently not part of the recommendation for COVID-19.
All right. And then kind of on the opposite end of the spectrum question, so with constant daily, sometimes hourly usage of hand sanitizer, is there any concern that it would reduce its effectiveness if the crisis lasts longer than anticipated? And is there any recommendation usage around how many times someone should use hand sanitizer daily?
Do you want me to? This is Linda. I can answer that. There isn't any evidence at all that hand sanitizer becomes less effective the more you use it. It isn't like antibiotics. It's an antiseptic, and it remains effective. In terms of how many times to use it before you wash your hands, it's really subjective. If your hands are visibly soiled, then you want to wash your hands with soap and water anytime your hands are visibly soiled. Other than that, you can continue to use hand sanitizer until sometimes people will feel after a while that their hands start to have a little sticky or feel a little buildup of hand sanitizer. It's kind of a subjective decision, though, in terms of when you need to go to soap and water, unless your hands are visibly soiled.
All right. And then that kind of ties a little bit to another theme that's popping up in regards to how long the infection or the virus may be contagious. So there's a lot of questions around having either a room shut down or a property shut down, and wondering if there's periods of time, 72 hours, or things that you'd recommend a week, and understanding when decontamination of the room is still necessary.
I could take a stab at that. This is Linda, and then if Ruth or Ed want to jump in. I think right now, the two things that you're thinking about is the virus that might be circulating in the air, and that's usually cleared within, a short period of time with air exchanges and in your facilities and in your buildings. And so just really waiting for a short period of time for the air exchange to occur. I would say hours, not days. And then if you have a place where you know that there's been a patient with COVID-19 or a person with COVID-19, if you clean and disinfect using the right disinfectant, and then you have allowed time for that air exchange, there isn't any reason why that has to be shut down past that point where you've disinfected. even if you didn't disinfect, as Ruth said earlier, it's assumed that the virus is going to survive on hard surfaces for 2 to 3 days. And so I don't know, Ruth or Ed, if you have anything you want to add to that for different settings.
Yeah, the other thing to keep in mind on that study that did demonstrate that survival for 2 to 3 days is that the levels of virus particles were dropping over that time period. So although they could be detected, they were at a much, much lower level than at the beginning. So, conservatively, if you can allow a room to sit for, 24 hours or 48 hours is probably better. But I wouldn't necessarily worry too much about going beyond that, assuming you can get in there with effective disinfection protocols and that your people are practicing all of the things they need to be practicing. Not continuing with hand hygiene because if virus particles might be picked up by your hands and then, touching so another one is not touching our faces, which is difficult, I realize. But we need to take this, kind of multi-pronged approach to reduce our risks.
I'd just add one more thing, maybe, Ruth, to that, and that is that maybe part of the reason that you need a little downtime is to assess who else might have come in contact with the person that was infected, and so that you can manage that situation as well and understand if there are other people that need to go into quarantine. And so it might take you a little time to investigate that a little bit, and you'd work with your public health authorities to do that.
That's a great point.
Yes, and along the lines of quarantine, there's a specific question around long-term and short-term care facilities, and if there's any suggestions around how to best isolate residents to prevent that spread through the facilities, and is there things like disposable utensils or other recommendations that we might have?
So this is Linda. I would say I know for certain that disposable utensils wouldn't be required and that you can use your standard procedures for handling dishes and food items. And in terms of the isolation practices, I would just refer you to the CDC. They have an interim guidance for long-term care that's pretty detailed and gives a lot of great information about how to manage that situation.
All right. Another question that is popping up is the usage of either handheld UVA lights or UV wands to help sanitize, or are they effective for COVID-19? Another thing that's kind of associated with that is high temperatures or any temperatures related to being effective against COVID-19.
I'll just start and say, in terms of effectiveness against COVID-19, the EPA does have their list of disinfectants that are recommended, and I did share, how you can determine if the disinfectants that you're using are effective against COVID-19 with emergent pathogen language or coronavirus kill. That would be a good place to start. In terms of UV, I guess I'm not sure what can be claimed using that type of device to disinfect against COVID-19. I don't know, Ruth or Linda, if you have any more advice in that area, but like I said, I would recommend sticking with a list of EPA recommended COVID-19 emerging pathogen or coronavirus disinfectants.
I'll just say that UV or any other no-touch technologies are always an adjunct to routine disinfection with a disinfectant that's approved by the EPA. So it's never something that can be used by itself to decontaminate a space, but it can be used as an adjunct. And I can't really speak to whether they have all the different companies that have those kinds of UV technologies have claims in that area. So I'm not sure about that, but I would definitely be asking if they had any evidence to support the fact that they're effective against COVID-19. But I just know that it'll always be used as an adjunct to routine cleaning and disinfection.
All right. And on the topic of PPE, we've had a couple of questions come in around face masks and hand gloves. So first on the hand gloves, there's a question around working in the food industry and still having a drive-up option that is open. Employees are wanting to wear gloves, but there's some questions around effectiveness, either with the usage of hand gloves and or proper hand washing every 15 minutes.
I'll take the glove side of things. They can be effective if they're used appropriately. We need to think about gloves as certainly presenting a barrier in between our skin, obviously, and something else. But gloves shouldn't be thought of as giving us, and they sometimes are, a somewhat false sense of security. You know, there still is risk in this case of transmission of COVID if a gloved hand that had touched an infectious surface or infectious droplet, if we touch our face with that or touch our eyes. So we need to be very, very careful about using gloves and not rely solely on them and, you know, kind of ignore the fact that we still need to be washing our hands effectively, practice cleaning and sanitizing and or disinfecting of the right surfaces and so on. But they could be an adjunct to it. Ed, do you have anything to add related to gloves?
I think you covered it pretty well, Ruth. Yeah, like you said, if you touch your face, if you touch any other PC with a glove, needs to be changed, and then proper hand hygiene underneath the gloves is obviously just as important as wearing the gloves themselves.
And similar to gloves, the question on face masks is just the effectiveness, and if you have a recommendation that people should be wearing them.
So,
Linda, do you want to
this is Linda. Yeah, yep. So face masks are best used, first of all, in healthcare because we have such a shortage that we really want to make sure that we have the face masks available for healthcare, and that includes long-term care. Secondly, the mask is best used on the person you suspect of having COVID-19 because it's going to block the droplets that Ruth talked about earlier. So that's the best application of masks. And I think beyond that, in the hospitality setting, I don't know that there would be a place for masks particularly. In long-term care, then you would put a mask on a person that you suspect of having COVID-19. You would put them in a closed room, and ideally, whoever the healthcare worker is that comes into the room to work with them would have an N95 respirator. Now, we know that we have big shortages of those around the country, and so the CDC is now saying that if you don't have access to an N95 in a healthcare facility, you can wear a mask instead. So I think that's the best answer to that question.
I think it's very crucial that we heed the advice of what we're all hearing and that the tremendous shortages of masks for our frontline healthcare workers is extremely significant. And we really need to reserve mask use for those who are caring for folks who are very seriously ill with COVID-19 because we can't afford to have those folks getting sick. And anything we can do to direct the supply of masks to that group is vitally important.
Absolutely. There is a theme around understanding more about how long the virus lives on specific surfaces. And Ruth, I know you had a couple slides specific to this. Was there any more information around soft or fabric, soft surfaces that people should be considering?
Yeah, there has not been study with the new COVID-19 strain on soft surfaces, but what we know from other coronaviruses like SARS is that it was not a significantly long time at all. And hence that's the recommendation, or feeds into the recommendation that Ed gave us related to essentially following standard laundry type procedures, but obviously trying to minimize potential spread by, bagging of linens, not fluffing them up or like hugging a bunch of sheets in your arms, for example, just to minimize that potential. But the risk is deemed very, very low.
All right. And it looks like there's just a handful more. But if a property or a restaurant is closed, is there any recommendation on frequency of cleaning if you don't have the same amount of traffic coming through the property?
So that would be for a property that's currently unoccupied with nobody in there, or would there be somebody on property?
It populated in the Q&A a couple times of if the property is shut down. So probably not for servicing.
I guess I can take this first stab at it, and then Ruth or Linda, if you have another opinion, you can help me out. But I would say that there's very little need for additional cleaning during the shutdown process. Obviously, your pool may need some maintenance. But in terms of disinfection and cleaning, that shouldn't be needed in that interim period.
But certainly,
I would agree with that.
you would, before reopening, you would want to go through and do a thorough cleaning and sanitizing, and perhaps consider disinfection of those high touch point sites and of non-food contact surfaces.
Exactly. I would say when you close it down, you would clean everything and disinfect and sanitize thoroughly, and then there wouldn't be any need to do anything further.
No.
All right. And then that actually brings us probably to one of the last questions we have is about reopen procedures. Are there anything that people on the Q&A can refer to as far as now that they've been either shut down for a period of time? Are there procedures available to reopen?
That's a great question, and I'll say that is currently in the works right now. They're being developed. They'll be available shortly. So I would stay in constant contact with your Ecolab representative, and they should have availability to those procedures in the near future to help you disinfect and clean your facilities prior to opening.
Great. And sorry, call out to Kevin. I do see your question here. Dishes, how do I clean those? So there has been a handful of questions around dishes and the virus living on the dishes. Can we talk a little bit about that before we close?
Sure. So what I'll say is CDC guidance states that you need to use a dishwasher for reusable ware, so plates, utensils, and those sorts of things, using a suitable detergent and hot water temperature. So currently, both our high-temperature sanitation dish machines and our low-temperature chemical sanitation dish machines will use suitable detergent, and they both use high-temperature water. Even the low-temperature sanitation machines will still use 120-degree plus water. So if you're following CDC guidance, using a dish machine to clean your reusable ware is acceptable to limit any impact of COVID-19.
And I think it's important to keep in mind that we have no evidence of transmission of COVID-19 through any hard surface, which would include the surface of a dish. It's really from a droplet from a person, getting into another person is how transmission is occurring, not really significantly at all via these hard surfaces. But as a protection mechanism, it's important to follow these kinds of recommendations for the wares in dish machines and also hard surfaces as well.
Great. And now we're getting a flurry of activity again in the Q&A specific to fogger machines and bleach or electrostatic spraying of chemical.
Well,
so I can.
Go ahead.
Go ahead.
I was going to say for specific chemicals, monitoring that EPA list, following the schematic that Ed outlined on looking for the two parts of the registration number is really what you want to be doing for identifying the right products.
Mm-hmm. Right. Thank you, Ruth. And I will just say that there are very, very few products on the market that actually have fogging claims. And specifically related to COVID-19, I'm not even sure a product out there on the market. There may be one. Ecolab does not have one today. We recommend surface disinfection using standard procedures. That's going to be your most effective way to eliminate this virus using the emerging pathogen claim or coronavirus claim on a standard disinfectant product that's on the EPA list.
All right, and I do see a question regarding nurses, and if there's any protocol regarding nurses that work in a facility that may possibly have residents with COVID-19, if they're filling in for shifts and then coming back to their home facility. Is there any protocol that you're aware of about going between facilities or maybe to their home residents?
This is Linda. I would refer back to the CDC. They have really good guidance about that, and they do talk about, where possible, dedicating staff to work with patients that are known to have COVID-19. But realizing that there are staff shortages and that might be a challenge, it's really more about screening for symptoms for any healthcare worker, really, because they could just as easily be coming in contact with it, in another facility or, anywhere outside of a healthcare facility. So it's more about the need for screening healthcare workers for symptoms if you feel like there's a risk of it being transmitted. But I would refer you back to the CDC for the really best guidance that there is that's about how to manage this.
Great. So I know there's a lot more questions that are still coming in, and we're hitting the end of our time availability. So I just wanted to say a huge thank you to our presenters today, as well as our attendees for tuning in. For any additional questions or questions that we weren't able to specifically address today on the webinar, please be sure to reach out to your Ecolab representative or check ecolab.com frequently. We do have FAQs that we're updating there as well. Thank you so much.